taken a position against reimportation. How does that jive with the president's position? The drugs in Europe are unsafe. The drugs that they use in the European Union are unsafe.
So we have had a succession of Democratic and Republican FDA commissioners who have been unable to certify under the law that importation would be safe.
They've been wrong and beholden to the drug companies, frankly. You would have to sit there and say that the European Union has unsafe drugs and it would be unsafe for Americans to buy drugs from the European Union or from Canada or Australia. It's just frankly not true. It's a canard, and it's been going on year after year after year, and we have this enormous problem, and people say we're going to fix the drug problem, and it never happens. But what I think is important for America to know, this isn't capitalism. Walmart is capitalism. Bill Gates was capitalism. Big Pharma, it's not really Big Pharma's fault even. They're just trying to maximize their profit by using government, but we're letting them do it. We have this terrible system. So you get an EpiPen, you have it for 20 years, you manipulate one little thing in the spring, and all of a sudden they get another 5 years, and then another 5 years. So one of the things we could do that would dramatically change this is, if you have a patent on the EpiPen for 20 years, you get it. If you change it and make it better, you get a patent on the new EpiPen, but guess what? We can have generics on the old. Currently, you can't have that. And we have all these impediments. Why don't we have generic insulin? But it's going to take someone who really believes it. And I told you in my office, you've got some convincing to make me believe that you're going to represent the American people and not Big Pharma. And I know that's insulting, and I don't mean it to be, because I'm sure you're an honest and upright person. But we all have our doubts because Big Pharma manipulates the system to keep prices high. It is not capitalism, and it's big government, but we've got to fix it. We can't tepidly go at it. We have to really fix it, and you need to convince those of us who are skeptical that you'll be part of fixing it and won't be beholden to Big Pharma.